7 years ago, then Health Minister and your Fine Gael colleague Simon Harris promised that no child would be waiting longer than 4 months for scoliosis surgery. That promise was never met, and of all of the broken promises by your government, I think it's one of the most callous. The fact is that there are now more children on scoliosis-related waiting lists now than when Minister Harris gave that commitment in 2017, and this has happened on your watch, Taoiseach. There remain, as of this month, 327 children on waiting lists for scoliosis-related surgery. This is not acceptable. The families and the children involved deserve better. Last night I met with them. I listened to their concerns. I listened to the tragic stories of those families, to the pain that their children are in, to the life-limiting state in which many of these children find themselves, and it is heartbreaking what these children and families must endure. They feel that they have been left down because government promises have been made and broken time and again. Mohin na chawli sugar ligoshias iad tishk go bhfuil gealtanis an rialtas brista a rish is a rishella. 2 years ago in 2022, I raised the issue of children with scoliosis waiting years and years here in the Dáil. I visited Kappa Hospital, met with CHI management. I also met with parents and advocacy groups. The government subsequently committed to €19 million of additional spending on the promise that this would result in no child waiting longer than 4 months by the end of 2022. And that promise has also been broken. Astoundingly, the Minister for Health, Stephen Donnelly, informed the Dáil last night that he cannot guarantee that those €19 million were spent for the purposes for which they were intended. He doesn't know. The government doesn't know. What we do know is that far too many children are waiting and waiting and waiting. One such child is Kylie Ann from Donegal. Kylie Ann is 10 years old and she has been waiting 5 years for life-changing surgery, half of her young life. Kylie Ann's mother has challenged all of us in here to see Kylie Ann as she sees her, with love, to give her the chance and the quality of life that she deserves. And I think we should meet that challenge, Ceann Comhairle. And that's why our motion tonight matters so much, because these children deserve better. So, Taoiseach, will you agree to work with us, with the parents and advocates, to establish a task force that works? Will you work with us to achieve accountability and transparency? Will you work with us to put in place the plan that delivers finally for these children? And Taoiseach, there is an urgency to all of this. Every and all treatment option must be on the table for these children and young people. Everyone must commit to doing everything necessary to ending what is a scandal of children waiting for spinal surgery once and for all. Our motion sets out that plan to address all of these matters in cooperation with parents, advocates, clinicians and with you, Taoiseach. So can I ask you, as a gesture of seriousness and goodwill, to withdraw your amendment to our motion this evening? Can I ask you to work collectively with us to finally crack this and get the job done? Because the plan that we have set out is the plan that the families want implemented. And as I understand it, Taoiseach, they are looking to meet with you to discuss that plan. Will you meet with them?
Taoiseach, please.
Gurmadi Ceann Comhairle agus Gurmadi das a good ceist Oireachtas agus Taoiseach gom tá 5 mór going leis an service sin agus tá brón I know from my own experience, having worked in medicine as a doctor with what seems a long time ago now, that the problem of failures in inadequate services when it comes to spinal surgery and scoliosis and spinal bifida surgery for children is one that goes back, sadly, generations, many more lifetimes than these children have yet experienced. And I absolutely guarantee you that if it had ever been an issue simply of money, our political will or how much we care about this, it would have been resolved a long time ago. And I don't have adequate answers as to why it hasn't been fixed, but I do intend to do anything I can to establish why not and to put things right. And you have my assurance on that point, Deputy, and I'd be happy to work with you, provided it's in good faith, to deal with this issue, because it shouldn't be a political football. And I know that's not your intention, but I think there's others who would make it such, and we need to stand together against those and work together to resolve this issue, which will take more than one government to solve, in my view. But at least let's get started on it. At the outset, I want to acknowledge that there is no doubting the worry, anxiety and pain for many patients and families attending these services. A comprehensive patient safety review has been commissioned into paediatric orthopaedic surgery services. This is independent and is led by independent expert Mr. Nayam. Concerns initially related to the clinical outcomes of some complex surgery, including what appears to be a higher than normal incidence of post-operative complications and infections and 2 serious surgical incidents. This, of course, does not necessarily mean that somebody did something wrong. These may have been high-risk patients that other doctors wouldn't operate on, but we need to make sure we know the facts before we make any further decisions. 2 additional patient groups are now being included: patients who've been randomly selected for purpose of audit, and patients who've been identified as potential cases of concern by other surgeons in CHI. Those directly affected have been informed, and patient advocates have also been informed. After meeting with the paediatric orthopaedic surgeons, the Minister for Health has also determined that a dedicated paediatric spinal surgery unit should be established. Mr. David Moore, a consultant surgeon, has recently been appointed to head it up. The Minister met with him in January. Senior staff have been appointed to the new unit, and the Minister has requested that a task force be convened as soon as possible with an independent chair. The task force will include all stakeholders, including patient reps and clinicians, and this is a model that has worked well in other areas like haemophilia and CF, for example. The Minister wrote to and invited all advocacy groups to meet with him, and seeking their engagement and their views on terms of reference for this task force, which will have an independent chairperson. And he met with a number of the groups earlier this week. The Minister's invitation to meet those who did not attend or request separate meetings remains open. Mr. Nayam has met with the Minister for Health, families and patient reps and other stakeholders, following which he finalised the terms of reference for his independent review. In addition to that, the Minister has asked HICWA, the independent patient safety regulator, to carry out a statutory review of the use of springs that were not CE marked. In relation to the waiting list, Deputy, just for your information, we have significantly increased the number of procedures being carried out. Just take 2019. We often use 2019 as a base year for comparison because it's the year before the pandemic. 380 spinal procedures were carried out. That went up to 509 in 22 and 464 in 2023. So there has been a big increase in the number of procedures being carried out, and waiting lists have gone down. As of the end of last year, 78 patients were on the active waiting list, which was a reduction, and 231 are awaiting spinal procedures. I'm advised by the Department of Health that Sinn Féin has miscalculated the waiting list figures. The claim that 327 children on the waiting list is incorrect, even if you include those who are only waiting a few weeks.
Thank you, Deputy McDonald.
Well, tá níos mó ná 5 ounce sa scéil seo, tá sé scanalach go bhfuil daoine óga ag feitheamh, is ag feitheamh agus ag folingt mar seo, tá sé scanalach. Sin an focal ceart atá I gceist. I've raised this personally, this issue here for a decade almost, and I know other colleagues have also. And it's time now to confess and own up to the fact that this is utterly scandalous, Taoiseach. The children in that degree of pain are left to wait and wait and wait. And more scandalous yet, that your Minister for Health could present himself last night and say he doesn't know where the €19 million that was to be dedicated for their treatment, he can't tell us where it went. So I'm not interested in a political football. The families and their advocates aren't in. We are interested in a credible, good faith response from your government. And that means accountability. And it means action. And it certainly is not acceptable that you can't answer basic questions around where the resources have gone. But let me repeat again, Taoiseach, will you withdraw the amendment? Will you take in good faith the plan that the families and advocates support, and will you meet with them to discuss that very plan?
Thank you, Deputy Taoiseach, please.
Thanks, Deputy. Is 5 more is túbhaiste I Mhuirmse. Agus Tommy de Glurg níos má ólas, agus Tommy de Glurg an 5 sin réitach. And Deputy, I have met the patient groups and I'm happy to meet them again. It's not my practice to organise meetings on the floor of the House, but I'm happy to meet them again as soon as there's a gap in my diary. But there are different groups and they don't all agree with each other. And you know how complicated it can be to deal with an issue when you've different groups representing the same people with different perspectives on what should be done and what should not be done. And acting in good faith, Deputy, means being big enough to admit it when you've got your numbers wrong. And it also means not misrepresenting the Minister in the House. It's not the case that we don't know where the 19 million is spent. We know where it was spent. Provided for an additional 204 healthcare professionals working at least some of their time on spinal surgery in Temple Street, in Crumlin and Kappa. It provided for a 5th theatre, which is now open in Temple Street. It provided for an additional MRI and also for additional beds. What we can't establish for certain is how much of the 19 million was spent exactly on this, so we need to find that out.
Thank you, Taoiseach.
No, it's not the point. Well, what the deputy has used misinformation about the waiting lists here on the House, and she's also claimed that the Minister said that he didn't know where the money was spent. That's not what he said, Deputy. 200 staff, more beds, a new theatre, and a new MRI. And if you honestly want to be involved in helping us to deal with the solution, which shouldn't be a political football, you need a different approach.
Thank you, Taoiseach. Can we stop the heckling, members, please?